Awareness is growing surrounding postpartum depression, but there is new hope in the form of a postpartum depression pill. Here to talk about it and this overall condition is our health insider, Dr. Shadmar Vasti. Good morning.
Good morning, Nolan.
So with postpartum depression, we are hearing from more and more women finally feeling empowered enough to share their stories. We've changed the term. Back in the old days, it was known as the baby blues, but this really is an emotional, hormonal issue, and it can have a major impact on families. So let's talk a little bit about what it is.
Absolutely. Postpartum depression is essentially, just changes in mood and depression after giving birth for a new mother. Basically, can have mood swings, anxiety, irritability, feeling overwhelmed, kind of emotionally labile where you might be crying one moment, difficulty sleeping, all the typical symptoms of depression. And the impact is really important. Is really important to consider because it can impact the ability of the mom to bond with their baby, connect with family and friends, lead to thoughts of harming yourself and confusion. And that impact is really critical because when you think about the relationship between the newborn and the mother, that development is also part of their healthy development as a baby and as a child. And that can have long-standing impact on their health as well. So it's definitely something that needs to be screened for, that we routinely do after a pregnancy for new moms, and something that needs to be treated. You can't just kind of leave this to something that you're going to just go ahead and try to feel better. We can't ignore this.
Yeah, and right now the statistics show 1 in 8 women experience this after giving birth. So what does current treatment look like?
So, currently there's one drug that's specifically for this that is given IV for 60 hours in a healthcare setting. And that's called Zolresso. The other option is just to put them on an antidepressant, like Prozac or Zoloft or any of the other ones that are out there. And then, keep that on for 6 months or whatever, and making sure that the symptoms are addressed, and then eventually trying to wean off of that. But that's a longer treatment course. It's not something that you would just kind of say, I'm going to give it and be done with it.
That's one of the things that people are getting pretty excited about with this new treatment, zuranolone, and it's so far showing pretty minimal side effects. So what do we know about this other than that it is a pill form? It wouldn't be an IV this time.
Yeah, what's interesting about this new medication, zuranolone, that it's really actually been designed specifically to be taken for only 14 days. The data was pretty compelling. Dizziness, fatigue, sleepiness, some non-specific symptoms like that, which are the potential side effects. But they didn't, see any withdrawal symptoms or any risk of increased, suicidal thoughts or behavior or loss of consciousness, which is really a good sign. And then the research that's been done so far has also seen that the results last well after that 14 days. So in other words, a mom would take this for 14 days and then pretty much be done and have relief of those depression symptoms 3 months, 6 months, even up to 12 months later.
What do you say to families? What do they need to know about also building that support system? Should this come up with the birth of a new baby?
You've heard expressions of it takes a village, right, to raise a child. And, this is true in indigenous cultures around the world. They come together and they just support and are constantly around them and helping them with meal delivery or, errands, right? And actually doing that. And so I think the extent that we can kind of replicate something like that with a newborn, if you're, have that in your family or extended family, giving all the support that you can give. And for those new parents, I think it's really important to, keep them engaged in social interactions, not to be isolated. And I think that's also the role of, the other partner, to make sure that the new mother is supported and not feeling overwhelmed, because they will feel overwhelmed. That's inevitable. But, having that support and being aware of it and taking the time, right? And that's why companies have started doing, both maternal and paternal leave, because it's important to have that full support available. with the newborn. So I think that those are things like that, and then being active, right? We know that exercise, cardiovascular exercise, is a natural antidepressant. So as soon as possible, getting into activity as well, giving the mom time to be able to do self-care and have that space as well. And it's okay not to feel guilty that, you get a couple hours of that self-care, even if it's away from baby for every day, just to be able to do things like exercise and do things that help boost and keep up your mood.
And you and I are both parents, so we both speak from experience, certainly on this one, that you're absolutely right. It is overwhelming. Sometimes you don't know the help to ask for, but it is okay to receive it. And there's certainly a lot of hope here for those mothers that truly feel overwhelmed on many levels. So really interesting insight and hope this morning, Dr. Shad. Thank you.
Yes, thank you.